We're going to talk to a doctor right now. This is actually not a laughing matter, because this Ebola crisis that is developing, folks, is pretty serious business. It's about as serious as it gets. It's about as the closest thing I could say that Mr. Obama has done right in responding in the way he has responded to the Ebola crisis. Some lawmakers on Capitol Hill are saying he should have responded sooner, but hey, I mean, at least he's doing something. He's not waiting for a year until, like he did with ISIS. Let me bring on our next guest, Dr. James Pickney II. He's a board-certified family medicine physician. Dr. James studied general surgery at the prestigious Cedars-Sinai Medical Center in Los Angeles. After graduating from Baylor College of Medicine in Houston, he is the founder and CEO of Diamond Physicians. It's a concierge medical practice focused on the patient-physician relationship. Diamond bypasses cumbersome and inefficient middlemen to deliver personalized, high-quality medical care to its valued clients. Dr. Pickney, welcome to WBAP on the Chris Crock Show with me, Chris Salcedo.
Hey, thanks for having me on the show.
All right, this Ebola crisis, as it's being called, is my understanding we haven't hit the 1,000-person mark as far as deaths are concerned, but they're telling us it's well within the realm of possibility.
Actually, Chris, we have.
Well, we did.
Death toll at the September 16th, so 2 days ago, and this is by the World Health Organization, 2,461 deaths, and just under 5,000 confirmed cases at 4,985.
Wow, I must have seen a report that must have been dated a couple of weeks ago, because it is really starting to pick up steam. Am I right?
It really has. In the last 3 weeks, those numbers have doubled. So let me take you back to August, when we first started covering the story, August 2nd, 1,300 cases and 729 deaths. Those cases trickled up, and 3 weeks ago, or over the last 3 weeks, I should say, it doubled. So this is a big deal. This is a major issue. This is the worst epidemic in our history for Ebola virus.
Now, why is this particular strain of Ebola so formidable? What is worrying so many officials around the world in the healthcare community?
Well, this particular strain isn't as virulent as previous strains, meaning that the mortality rate is not as high. Ebola typically can have a fatality rate of 57 to 88%, while this virus is around 55%. So you have a 1 in 2 chance of surviving. However, the way it's transmitted is actually very efficient. This virus is transmitted by direct contact, and because the healthcare system and the public health system in West Africa is poor, and the culture there, they actually embrace the corpses, they do a washing process, and that is really transmitting the disease exponentially.
So is my understanding it was bodily fluid, so that has changed now? It's only contact?
No, it's definitely body fluid. You can't just touch a corpse, but you have to get some type of bodily fluid on mucous membrane. The inner part of the eyelid is actually one of the most common sites of transmission. So any type of body fluid, blood, urine, feces, and possibly even sweat. It's not airborne, not respiratory droplets, but close contact with body fluids is how it's transmitted. So if you're washing a corpse, those body fluids and things can get on your fingers. You touch your mouth, you touch your eye, and there you have it.
We're having a conversation with the founder and CEO of Diamond Physicians. His name is Dr. James Pickney II. So, Dr. James, I am hearing the possibility that this virus, as it continues to work its way through populations, there is a danger of mutation, which could, you mentioned it's not airborne now, but how likely is it that it could, if it goes unchecked, evolve into an airborne strain?
Well, Chris, the chances are actually extremely unlikely that it will evolve into a respiratory airborne virus. The way these things work, viruses actually have kind of a lock and key mechanism to attach to a cell. So the virus has the key, the cell has a very special receptor that the virus can lock onto, and you have to have evolutionary pressure for that virus to want to mutate. And right now, it's transmitting extremely efficiently. So there's no evolutionary pressure for it to mutate. And if it does, it has to mutate multiple times for this virus to want to attach to the respiratory tree, to mucosa in the lungs. And then when it replicates in mass quantities, it would come out in respiratory droplets and become airborne.
How does it attack the body? Well, I mean, what does it do to you? And it's not like is it the most extreme flu you've ever seen, or what does it do to you?
It starts out as the most extreme flu that you've seen. It starts out with fevers, chills, general body aches, weakness, fatigue, severe headache. You can have pain in the lower back, nausea, vomiting, and diarrhea. So just like the flu, that's the way Ebola starts. And what it does, it actually attacks your capillaries. So it attacks what we call the endothelial lining of your blood vessels and breaks down those blood vessels to where they begin to leak. It's called capillary leak syndrome, and those fluids leak into tissue spaces where they shouldn't be. We call that third spacing. Blood pressure drops. You can develop hemorrhagic fever. Now, the gross bleeding from all orifices is quite rare. So if you've seen the movie Outbreak, they start bleeding from the eyes and the mouth and all that. That's actually pretty rare. But you can have a little bit of bleeding in the eyelids, easy bruising, and if you do have an IV in, then that venipuncture site can also bleed.
What do you think about the reaction by the World Health Organization and by the United States under the direction of the current occupant of the Oval Office? Has it been right on par? Has it been too timid? Has it been overly aggressive in your view? What's your opinion?
Well, Chris, that's your job to give opinions on how the president's performing. But I will tell you this. Yeah. This is a huge problem. So I definitely agree with the 3,000 troops being sent over and CDC ramping up the experts that are going into the region. As again, over the last 3 weeks, you have doubling of the amount of deaths. Yeah. That's a big deal. That's what we call exponential growth. So you could see 5,000 cases in the next 2 weeks. You can see the public health system was already weakened. Clinics and hospitals and emergency rooms are burdened. They're maxed out. They can't take care of any more people. People are actually dying in the streets over there, Chris. It's really bad.
Well, so now the whole strategy is for containment, right? They want to keep it in one geographical area so it can't escape.
Yeah, you have to contain, you have to prevent the spread in that area, and then hopefully prevent the spread to other countries. And then here in the U.S., the CDC sent out a 6-page report to all hospitals and emergency rooms in the country, basically briefing them on protective gown procedures so that if an infected person does come to U.S. soil, we are ready. So how do we contain that virus in that particular ER? We're supposed to have a media relations employee that has been trained to talk to the media, proper removal techniques of contaminated gowns and masks and gloves. So I think preparation is key for us. If this virus does spiral out of control and it comes to U.S. soil, it has to be contained, or we're going to have an epidemic like the 1918 influenza epidemic that killed 1/3 of the population on this planet.
Good grief. Dr. James Pickney, he is board-certified family medicine physician. The place that he runs, he's the founder and CEO of Diamond Physicians. Dr. James, if they want to find out more about what you guys do, where can they go?
You can go to diamondphysicians.com, follow me on Twitter at @the_Dr. James, or shoot us an email at info@diamondphysicians.com, and I'd love to chat with anyone that has questions about the future of healthcare in this country, which is concierge medicine, affordable medicine, also known as direct medicine.
Appreciate the time and expertise as always, Dr. James Pickney II from Diamond Physicians. Thank you, sir. Appreciate it.